My name is Susan Rausch. I work at Virginia Mason in the Sleep Disorder Center, and I am at the downtown facility and on Bainbridge Island. Well, sleep medicine is a new field. It's an amazing field. It can help so many people in so many ways, and it's incredibly gratifying to, with pretty simple interventions, help somebody to really feel so much better. Well, I treat obstructive sleep apnea, restless leg syndrome, what we call parasomnias, which are things you do in your sleep that you aren't aware of: walking, talking, screaming, yelling, eating, narcolepsy, and insomnia. So I've been in medicine a little over 20 years, and I initially worked in pulmonary critical care as well as in sleep. So my background, in addition to sleep medicine, is also in pulmonary medicine, which is the lungs. And very often in sleep medicine, you'll have a doctor that may have a background in either neurology or psychiatry or pulmonology. Those are often the specialties that will lead to a physician also being trained in sleep medicine. I've done fellowships in all of those, and now I focus primarily on sleep. So my favorite part of the day is having a patient who understands and is happy and why they needed to come to see us. Often patients come in not knowing why they're there, a little worried, nervous, uncertain, but after explaining what could be going on, after doing testing and seeing a really, really good outcome where a patient is sleeping well, they feel rested, they're in a good mood, there's just really nothing better that you could ask for. When I first started in sleep medicine about 20 years ago, as an example of technology and how it's changed, the CPAP machines used to be big. They used to not come with humidification. There was one type of mask that we could use, and now we have small, quiet machines that are much more comfortable, a lot of masks you can choose from, and a software within the equipment that is both comfortable for patients and provides us with a lot of data. So I really love being at Virginia Mason. I have just wonderful colleagues who are not just experienced and knowledgeable, but also very friendly, very patient-oriented, meaning we really care, and we seem to all have as a similar goal to really try to take care of our patients to the best of our ability. And the staff, we're all really, really motivated to try to offer the best care in as efficient a way as possible. I think it's an amazingly hopeful and exciting time, and it's an incredibly wonderful and rewarding and awesome experience that I've had to be there when really an area of medicine, a field of medicine, was born in the time that I was a practicing physician. There aren't too many areas in medicine where that's the case of the doctors who are practicing in that area. So we have just an exploding knowledge base now. We have equipment that's now available. We have just so much understanding of how important sleep is to us that we need to really have sleep be one of the fundamental underpinnings of our treatment. So when I'm not working, I like to garden, I like to read, I like to play with my dogs, and I like to be with my family.